One of the people lying in this cemetery in Lusaka, Zambia, is Mavhunga, a Zimbabwean who died earlier this month at the University Teaching Hospital, Zambia's largest hospital. No one followed Sibanda to Zambia or claimed her body. Lusaka Manikwawo, a fellow Zambian who befriended Sibanda at the hospital, had tried to take care of her. She explains how she felt burying Sibanda in Zambia away from her relatives.
I was hopeless because the job was just too much for me. I couldn't bear it. I felt bad as well because someone to just die like that without relatives.
Kambanikwawo said Sibanda had left 3 children in Zimbabwe. Tafadzwa Masimba, a nurse from Zimbabwe who works in Zambia, says she understands why her fellow citizens are seeking health services here. It's free to those who can't afford it.
You can access any health service that you want at a government hospital, and then it's usually for free. If you have to pay, it's like you pay just a very low amount. It's very affordable. And then there are also doctors everywhere here. It's like the doctors are in the hospitals 24/7.
Imran Raymond Vaidia is a social aid officer with IK Charitable Trust, a non-profit that has been assisting foreigners, including Zimbabweans, who come to Zambia for medical treatment.
We normally assist foreigners, especially Zimbabweans, in repatriation to get back to where they came from, 2, we also assist Zimbabweans in purchasing of spectacles. We also assist Zimbabweans in payment of lab tests. As you all know, it is very difficult for a foreigner, especially a Zimbabwean, to be put under NEMA.
NEMA manages Zambia's national health insurance. Ministry of Health officials declined to reveal the cost of treating Zimbabweans in Zambia. Natalie Mashikolo of the University Teaching Hospital says Zambians treat Zimbabweans as their relatives.
Obviously, you would expect if a patient from Zimbabwe comes here, it's just automatic for you to know that when you look at them and you assess them, you know that these people the Zimbabweans cannot pay. So that's why we cannot turn them away. And when they're discharged, we contact the embassy and see if there's any way they can help. If they can't manage to help, then we bring in our cooperating partners.
These cooperating partners include IK Charitable Trust, which assisted in Sibanda's funeral. Many hope that Zimbabwe improves its public health system so its citizens do not die abroad seeking medication, as in the case of Sibanda. The Embassy of Zimbabwe in Lusaka and the Ministry of Health in Harare could not be reached for comment. Mavhunga for VOA News, Lusaka, Zambia.